Folks, thanks for coming on with us today. My name is John Dubas with Premier Marketing. We'll be spending the next 45 minutes to an hour or so discussing one of the more intriguing segments of the Medicare market, and that of a dual special needs plan. And today's presentation will focus on the long-time offering made available to us through United Healthcare's programs designated for this population. A bit of housekeeping note, today's presentation is being recorded, and it, along with much of the data that we will reference through the course of the presentation, will be sent to all who have RSVP'd to today's webinar. Keep in mind that that will take a little bit of time. It hopefully will be completed by the end of the day or quite possibly in the morning, as sometimes these webinars take a bit to upload into the system, the recordings do. So watch for that with us and look out for the presentation as it comes to you as well. A bit of background about our organization and a request for any questions to be entered into the questions box on the software system. Premier Marketing, for those who aren't familiar with us or as familiar with us as some of the others, we are a national marketing organization founded in 1968. We're part of the Integrity Marketing Platform with offices across the country. We act as an insurance wholesaler, offering insurance services to and through independent insurance agents with contracts available at the highest possible commission levels, with recruiting contracts available to those who qualify. As I mentioned, we were founded in 1968, so that means we've recently celebrated a bit of a milestone, our 50th anniversary. We feel that's quite an accomplishment for an organization that started out as a small family agency in rural Nebraska that's grown into one of the largest organizations of its type in the Medicare space. We do so through a full insurance portfolio that includes Medicare programs such as Medicare Advantage plans, Medicare Supplement programs, and the standalone Part D prescription drug programs. We also offer a full portfolio of life insurance and annuity products, including final expense life insurance with pre-need programs available as well. In addition, we offer long and short-term care programs, disability income plans, and ancillary benefits such as dental, vision, and hearing programs, critical illness and cancer plans, and hospital indemnity programs. That Medicare Advantage portfolio includes all the national carriers and many of the regional carriers that make a difference for you in your market. And that philosophy carries over into the PDP arena, where the national carriers are there for you through our organization. The Medicare Supplement portfolio is very large, and we offer some unique programs that help you market to that space as well. The ancillary products, in each of those categories, you have the leaders in that field, and they offer some very unique marketing opportunities, but additionally fill some of the gaps that we have that are left with the base medical programs that we offer, regardless of whether or not they're a Medicare Supplement or Medicare Advantage program. These are programs that can really help the population we serve. When we look at that population and the Medicare market and the opportunity it has, you don't get on a webinar like this or any type of presentation where we don't speak to the aging of the baby boomers. 10,000 people a day, one every 10 seconds, whatever data you want to base that on. Keep in mind, that's basing a assumption of people turning 65 and older going on Medicare immediately, and that being the only population that's eligible for that coverage, when we know that's not the case. There are many people who continue to work past the age of 65, and a number of those individuals do not access their full Medicare benefits upon that birth date. You have people working well into their 70s in certain circumstances, and they may be deferring their Part B and their Part D enrollment because of those circumstances. And we also many times then neglect to take care of or look at the medically disabled, that population under the age of 65 who have qualified for Medicare benefits based on disability. It's about 1/6 to 1/7 of the population, so it's a very substantial number of individuals that we have programs that we can offer and take care of them as well, because it's a really diverse population regardless of their age. Many of them are affected with different chronic conditions. Their body is telling them, hey, I need help in this area. 2/3 of them have 3+ chronic conditions, and they may have challenges with their income as well. This particular graphic shows income below $24,150. That's now up past $26,200 for a median income, but that's still a substantially handicapped, in a manner of speaking, income situation as well. And having programs with a broad portfolio of products that can address people of different health circumstances and different budgeting requirements are necessary for us to really handle the population that we're targeting, because people have choices. When they enter into Medicare, they have the first basic choice. An old sales manager of mine with Prudential years and years ago used to say, the decision to make a decision is a decision. And he's right. Some folks will choose not to access the voluntary Part D and Part D programs and self-insure for everything but hospitalization. That is a very small segment of the population, but it's one we need to address because, one, they're either uninformed or a bit radical in some of their viewpoints, but there's a number of people that have both Medicare A and B, and that's all they do, or they may add just the drug component. So it's a substantial part of the population we'll address in just a moment, but you'll see that the majority of people that age into Medicare opt almost equally for the two more traditional ways of handling those out-of-pocket expenses. The folks that enter into a standardized, modernized Medicare Supplement program, regardless of the plan type. It's about half of that population. And the other portion is those who opt into a Medicare Part C program, where they are assigning their benefits to a private insurer, and that is who handles their claims and also offers sometimes a more substantial spread of benefits as well, including embedding the prescription benefit. So there are different choices available to our population, and that dictates that we need a full portfolio of products in order to address that entire population, because they have different needs and different things may be their hot button. And remember, what is important to them is what's important to us, and we have to make certain that they realize the choices that they have, the opportunities and drawbacks that they have, the old Clint Eastwood good, bad, and ugly approach of explaining everything, each and every circumstance, and also what fits their budget. Because much as if you were a securities licensed individual, one of the things that you have to determine is risk tolerance. And this is part of an overall impression for this population as well. As I mentioned, it's almost an even split for those who are entering into plan choices with initial Medicare enrollment. We look at this study from Deft Research, and we see my first decision to make a decision. There's about 17% of the population that stays on original Medicare only. That doesn't necessarily mean that's all the coverage they have. They may be getting benefits as part of a retirement program, or they may be in another circumstance where they're accessing additional benefits. But for the majority of people, they're looking at Medicare Advantage or Medicare Supplement programs. So knowing what we need to do within each of those categories, the plan types with MedSups, the influence that the macro legislation finally had as to the first of the year, and then the different type of Medicare Advantage programs that are available, an MA-only program, an MA-PD program with medication integrated in, or special needs programs, much as what we'll discuss today. And one of the things we find also when we get into the Medicare world, much like any subset of our society, it kind of has its own languages. So having a translator of some of these acronyms can be very helpful. These are a couple of really helpful pieces that we found that help you with the translation of those points. I would send this as to part of the regular follow-up, but it's a very large document that's electronically, click on this and it'll get you more detail. It makes the follow-up too large to get through the servers. So part of what I do in the follow-up is request that if you're interested in this translator, so to speak, let me know and I'll send that individually to you separately from the regular follow-up. But getting to the point of today's presentation and looking at the different special needs programs, These are actually plans that were created by an act of Congress clear back in 2003 as part of the Medicare Modernization Act. It's been funding renewed through different pieces of legislation throughout the years, and they are a program that limits their membership to people with certain diseases or characteristics, and they tailor their benefits, provider choices, drug formularies to meet the most specific needs of the groups for which they are designated and to whom qualify for the different programs. There's 3 different types of special needs programs. One are the chronic condition special needs programs. We had a webinar on that last week. I'm going to include a link to that webinar as part of the follow-up to today's presentation. And keep in mind, just because a condition is listed there doesn't mean there's a special needs program designated for that particular condition in every market, or in some cases at all anymore. There are special needs programs that are designated for folks who live in an institution. For the broker community, this doesn't have as big of influence on us because in many circumstances, if that sort of SNP is available in your market, in many circumstances, the carriers have a captive force that markets that, and it's not available as part of a independent broker's portfolio. And we get into then finally to the category that we'll discuss today in general, and then specifics of the dual special needs program. And these are programs that have been designed and are set up for folks that have both Medicare and Medicaid. To qualify for these programs, the consumer must be entitled to Part A and be enrolled in Part B. They need to qualify for Medicaid assistance and normally at the minimum of QMB to fully access benefits. They need to reside in the service area and not have end-stage renal disease, with certain exceptions. There are, believe it or not, chronic special needs programs in certain markets that market specifically to that program. And one of the changes coming in 2021 is that folks with ESRD will be able to enroll in Medicare Advantage programs at that point in time. Keep in mind, not to confuse you, that's 2021. In 2020, the ESRD is the only health condition that would keep a Medicare beneficiary out of an MAPD plan in general and a dual special needs program specifically. There has been recent movement as to how often a person can enroll in a dual plan or change programs. It used to be every month. Now it's once every quarter for the first 3 quarters. We're going to cover that SEP in detail in just a bit. And generally, the coverage begins the first of the month after a person submits a completed and approved application. Because folks are looking at this program based on certain eligibility factors, and they're also limited to those factors, there are certain things that come into play as requirements from the government for special needs programs. They're for specific health circumstances. They got to have that health circumstance. The drug list, the formulary, is designated in many circumstances to address that. And we see in certain circumstances that the formulary for a dual SNP plan doesn't vary much from a regular MAPD plan, but there are exceptions to that. And keep in mind, anytime you have a special needs program, it's generally on either an HMO for the vast majority of the time or a PPO platform, and requires that the prescription coverage be embedded in the program. And they have certain care coordination programs set up within that program as well. So you don't see a dual special needs program on a fee-for-service chassis because it requires the embedding of the program and a control of some of the costs through a closed network of providers. When we look at some of the changes that came about from 2019 to 2020 in the enrollment periods, it's not so much a big difference from 19 to 20. It is more of a difference from 18 to 19. We still have the standard enrollment periods, the annual election period from October 15th through December 7th, the non-renewal period then from the 8th through the end of February, and the OEP period that we're going through right now. We did a webinar on these special election periods and OEP in the past. That too, the link to that recording will come to you as part of the follow-up of today's presentation. What makes the difference for us are the special election periods that affect the particular programs that we're discussing today, the dual special needs programs. There's about 20 of a standard SEP. I didn't update the date on the top of this, my apologies. It's a 2020 list as well, and it talks about some of those special election periods and how they affect special needs programs as well. United Healthcare does a really good job of giving us additional information that help make these periods clearer for us. This gives us a bit of a map across the calendar as to what period applies when, and a further designation and explanation of the programs through additional graphics. They do also make available a really stellar election period booklet that explains the different enrollment periods, and this will come to you as part of a follow-up to today's presentation as well. When we get into some of the SEPs that particularly affect duals and low-income subsidy, this is where we see a substantial change from 2018 to 2019 that carries into 2020, where in the past the person could change each and every month. Now they can only change one time per calendar quarter in the first three quarters of the calendar throughout the year. The annual election period is what's used for the fourth quarter or other SEPs they may qualify for. You have to keep in mind too that they've taken the dual and low income subsidy population and kind of slivered off a portion of this SEP based on those that may have special qualifications within that subset. Those that were auto-enrolled in the program, those that gain, lose, or change the status within the assistance that they have. These are separate from the standard dual LIS SEPs, and there are also different programs available for those that are considered at risk. This is in response to, in a large part, to the opioid crisis that we have. So they'll look at folks as to certain medications they have, judge them as to whether or not they actually qualify for these SEPs. One of the things that United Healthcare is very helpful at is allowing the agents to call in and verify the special election period for this population, and it then allows you to proceed with an application with less trepidation in this circumstance, and we make certain that the enrollments become actually active and not just mud thrown up against the wall. Some of the things we also have to take in mind is what exactly is Medicaid and how it affects these enrollments. We hear a lot about Medicaid and how it applies to folks that are in nursing homes or for disabled children living at home. There are special rules for that population, and what we discuss today generally are different than those rules. What makes it even more interesting is the rules for counting income and resources can and does vary from state to state and from group to group as well. And we'll see that in further detail in just a moment. We also need to realize what an MSP is, a Medicare Savings Plan. These are Medicaid administered programs that work in conjunction with the state in which the individual resides. It is also a circumstance where there may well be names of, they may be labeled differently from state to state. And the individual may qualify in one state and may not in the other because of some of the rules that they have in those circumstances. So it's very important that if you work in multiple states, that you keep in mind you need to resource different rules per the state that you're working with. So that's something that's really important we need to look at and make certain that your information is current and available to you. One of the things that we do in today's presentation when we get into the United Healthcare specific portion of the presentation is we focus on Texas. It doesn't mean we don't look at the other states. It's just to go through each of the states would be rather laborious and a really long presentation. And while I am a bucket of sunshine in most days, most folks wouldn't want to deal with me all day long in those circumstances. So if you're looking at a state outside of Texas as well, many of the rules that we'll go through will apply to you, But if you're looking at California, ooh, there's a strange state, you know, or one of the other ones, Arizona, wherever else in the world you happen to be, Oklahoma, wherever it happens to be, we will get you information specific to that state as well. When you look at the different types of coverage you have within the Medicare Savings Plan arena, you have different categories that affect this presentation to a great regard. You have the qualified Medicare beneficiaries. They're sometimes called QMBs or QMB beneficiaries. This pays the Part A premium, if applicable, if the person doesn't have the full 10 years in for premium-free Part A coverage, and the Part B premium, which is that elective that varies from year to year that we see a lot. It also pays the Part A and B deductibles, and we'll go through that in specific, with co-payments and co-insurance also covered. For many of the dual special needs programs, this is the minimum coverage that's necessary for a person to access full benefits under these programs. It doesn't mean one of the other categories that we are about to discuss wouldn't get you enrolled in the program if you were looking at it. It just means you'd have substantial out-of-pockets that may be better served by one of the regular MAPD programs. Because the SLMBs, the specified low-income beneficiaries, this coverage only pays the Part B premium. When you look at the income of this individual in order to qualify for that and the Part B premium, you realize that's a nice, healthy raise in their accessible income each month, but it doesn't cover the medical expenses that you see with QMB. Much is the same thing with the qualified individual. The QI individual, it too pays the Part B premium only. That used to be through a block grant. It's made part of the Medicaid program through the Medicare Access and CHIP Reauthorization Act of 2015, MACRA. So we're seeing some different levels of coverage that give us selling opportunities with this SEP, but we have to be aware of what well may be the best coverage for these individuals. So overall, when we look at qualifications for the dual SNP, we went through the MA pieces that they have, or pardon me, the Medicare requirements that they have, but they also must meet certain income and resource eligibility tests. And these guidelines are set by law, and we haven't seen them officially for 2020 yet, but states can raise or eliminate certain tests. For example, 8 states and the District of Columbia have eliminated the resource test for all of the MSPs. So Alabama, Arizona, Connecticut, Delaware, Mississippi, New York, Oregon, and Vermont do not have the assets test. So if you're dealing with someone that's moving into a state that you market in that does have the assets test, it's important to make certain that we help these people realize that if they fail the assets test in their new home, they won't qualify for these assistances. The applications are generally submitted through the local Medicaid agency. Sometimes that's handled by the Social Security offices, and the process can start by those who complete the low income subsidy, the extra help for these programs. It kicks them into the system for qualification for Medicare savings plans as well. The eligibility is generally redetermined each year, so some of the folks with slightly higher of the low incomes can get a little bit nervous at the first of the year because that Social Security COLA, that isn't terribly substantial, but it may be enough to kick them out of eligibility for certain assistance programs. When we look at QMB recipients, qualified Medicare beneficiaries specifically, this is actually a result of legislation created in 1988 by Congress. Look at that, that's over 30 years ago, and 62% of the population that's eligible for this is still not enrolled. The specified low-income beneficiaries, a piece of legislation 2 years later in 1990, nearly 87% of this population is not enrolled. These are people that can be a very good prospect for folks that aren't chasing the true dual population, because these folks have a little bit different mentality than some of the full beneficiaries under these programs, and they are also greatly affected. Their income is, boy, you're eliminating that Part B deduction from their Social Security check. along with the Qualified Individual One, the QI1, which was created by the Balanced Budget Act in 1997. We went through some of the macro effects on that. These folks, you're bumping their income. They're very loyal to you for helping them with this system and the different items that you can help and target through the same process. Layering in low-income subsidy people really, really increases your prospect pool. This gives you kind of a guideline as to what you have for income levels for these different levels of assistance. The LIS level in here, these are 2020 limits. Those are out. You will get a chart for low-income subsidy qualification for the different levels of assistance that's available under that program. And with that, you could technically calculate out the increased levels of income for the individuals for QMB, SLMB, and QI1. Because what you have here are percentages off of the federal poverty level. The challenge you'd have is the assets limits may go up a little bit on the MSP programs, and those haven't been divulged, and you can't really calculate them based off of the increased assets limit available for folks on the extra help low-income subsidy program. Low-income subsidy, that number, that's 150% of federal poverty level. If you go back to QI1, that's 135% of federal poverty level based on 2019 numbers. SLMB's 120, QMB at 100% of federal poverty level. So technically, you kind of calculate that, but that's a wink, wink, nudge, nudge type of deal for your prospects and clients. Not something I would strongly recommend yet. Those numbers should be available 2 to 4 weeks. It had been in the past clear into April where they were released. We're seeing them released much earlier than what they have in the past. But right now, they are not on any official governmental site. And trust me, I looked. So some things that you can do and some things that you can keep in mind. One of the other things you have to be aware of as well when you work the dual market are the MMP programs. These are Medicare-Medicaid programs that are administered by the state in conjunction with the federal government. That takes a Medicaid individual and merges them into a singular program with Medicare administered by the state. Those are available in a limited number of states at this time, and within those states, and we'll go into Texas in particular, it's a limited market as well. Certain counties that this becomes involved in. One of the reasons you really want to make certain that you're aware of this, because it complicates some of the sales processes in certain states. Ohio can be a bugaboo in many circumstances across the board. But if a person's in an MMP program and you enroll them in a DSNP, you're wasting your time. You're not going to get commissions. Application won't count, and you can't really change some of the underlying coverage. It's not compliant for you to work on the Medicaid program they may be in. We'll talk about that in general. When you look at Texas in specifics, what you're seeing is a limited number of counties. Those counties happen to be the most populated counties in the state of Texas. So you see El Paso, Bexar County, San Antonio, Hidalgo down in the valley, Harris County, Houston, one of the largest markets in the country, and Dallas and Fort Worth, big counties as well, Dallas, Tarrant counties. There are things that you can do to make those counties still work for you, becoming closely involved with your area manager for the carriers, specifically with United. If United is one of the folks that administer the Medicaid benefit, as you see in Harris County, that might be something that becomes a lead opportunity in many circumstances. However, that's not something you'd want to go into right off the bat and say, hey, you might have leads for me in dual SNP. Well, they might. Are you doing anything for them? Be prepared to offer a resume of your qualifications in order to be deeply involved in that market. In Texas, the Medicaid Managed Care Program is referred to as Star+. There's a couple of different components that deal with the under and over 65 population. It is now in every county in the state of Texas. Different pieces come involved. Keep in mind, you're going to get this presentation not only in a recorded form, but in a PDF form, so you'll have this data too. It's really important for you in many circumstances because there are homes you will go into for a full Medicaid beneficiary or even QMB, and they'll have a membership card for Medicaid and be very confused about what you're talking to them about. So you need to be aware of what it is, ask to see the card, point out that it is for the Medicaid program, and what you're working on is a Medicare program that will work hand in hand with that Medicaid program to make certain they understand what's going on in your appointment as a base piece of education. How do you find these programs? Well, obviously Medicare.gov can be your friend. Plan Finder's had a bunch of challenges with some of the changes they went through, but it's still a way for you to determine where these plans are and where they exist and some of the specifics on them. Because even though you may be going into a home marketing United Healthcare, it's important to know what your competition is as well in those different markets and be prepared for different questions. And you can bundle down into that and find out where they are. And this is an example of a SNP program that's a chronic SNP program. It's got the C here, which you'll see when you go into the programs that are a DSNP program. Obviously, instead of a C, you'll see a D. And it'll lay out those different programs for you, give you an opportunity to visit in your own mind as to the strengths and challenges you have with different programs. The QI Medicare site also gives you an opportunity to determine what all plans are available everywhere, so you can find out, gee, what's available across the board in my home state. A great place for you to go and look and access that information. What you'll see over the last couple years and moving forward is a much greater emphasis on SNP programs, dual SNP programs in particular. We're seeing large increases in C-SNPs well, but this is a market that's designated specifically for the dual beneficiaries. It is a market that certain carriers have placed an emphasis on in the past, and you see some clear leaders in this space. The big gorilla, it's United Healthcare. One of the reasons we're doing this presentation is you're going to run across it a whole lot. You need to know about it. You need to have it as part of your portfolio of products. And Haiti, this is going to give us a bit of lead us into information as to how you can sell this product and contract with the carrier. This gives you some additional information on resources to get about Medicare programs. And for many of the programs, many of the companies will partner with Benefits Checkup from the National Council on Aging. There's some really great pieces that are available to you through this organization. But United Healthcare uses their own system, the My Advocate program, that can really help you specifically with United Healthcare dual SNP business. They have a component within their agent helpline that allows you to dial in and find out about, as I mentioned before, is a SEP available and what sort of underlying coverage that a person has for a level that they may qualify for. So it's really important when you look at this subset of business that you know the plan and the network, you know the differences between the different assistance programs, specifically in the state of Texas, the Star+ program, the different Medicare savings programs, low-income subsidy. And if you go into an appointment, and I would recommend an appointment with a dual program, you can sell them over the phone, but I personally feel a face-to-face appointment with this population, because there may be more than one individual involved in the decision, that helps your persistency, the retention of your enrollment on the program. And keep in mind that these multiple SEPs can work both ways. You might enroll a person in the first quarter, another competing agent with perhaps a different carrier may go in and swipe the business away. So as the Lord giveth, so he taketh away. Or I should say, as the Lord giveth, so she taketh away. It's important when you go through these programs that you work with the family and all the people that are involved in the decision process. Since you're going in there on a face-to-face program and you're giving them the sales packet, obviously you can't write in that sales packet or alter it in any way that's non-compliant. However, the beneficiary or their family sure can. And so make certain that they have your name and number on that packet, and that you go through some of the important portions of the program and that they thoroughly understand them and how they work. It's also really important that you work with the carrier. United Healthcare is really good about having face-to-face trainings in each of the markets, and they are very strong in offering these training opportunities by webinar as well. It just so happens I downloaded the webinars for February and March from United last night, and they are available on the Jarvis website, but those also will come to you as part of the follow-up to today's presentation. Keep in mind that the carriers have a ton of support material. The government does as well. So watch for those. If you have any questions, we are more than happy to help you with this segment of the market. Keep in mind, it's not for everyone. If you're one of those individuals that is very adept at cross-selling and it's an important part of your overall marketing program, if you're dealing with a person at 100% of federal poverty level and below, what are your chances of cross-selling a whole bunch of different programs with that population? Well, you might sell it, but will it stick? So keep in mind, we need to work through different types of programs for people at different layers of assistance. If you're looking at a QI1 or even a SLIMB at 120 or 135% of federal poverty level, they may well be a strong prospect for a dental program, because keep in mind, they don't get the dental assistance you see in some of the DSNP programs because they don't qualify for it. And it may be a need that you can help them with down the road. So remember, as you give these presentations, check all the extra benefits. DSNPs and CSNPs are one of the areas that you see a lot of the social determinant of health type of benefits come into play. Extra transportation, different assistance with key programs that include over-the-counter benefits, different plan types of, or different plan adjuncts that can really help in those different areas. There's even a CSNP plan in the state of Texas, chronic special needs program, that helps with air conditioning. So there's some different things that will really help you in that arena. When you visit with people about a DSNP program, don't concentrate just on their family doctor. Make certain that you go through the whole gambit like you do in a regular MA program and speak to the specialists that are involved, the hospitals that they prefer, but also make certain that you get details about the durable medical equipment suppliers that they may have, or the home health care agencies, because these two components are folks that visit with them on a very frequent basis and may be one of your key opponents in keeping the people on the plan. You got somebody coming in there doing home health care, and they may be having portion of that funded by Medicaid, and they don't know that. They're going to tell these people in many circumstances that, hey, you're going to lose my services. You won't qualify for them. If Medicaid's funding that, phooey on that. That's horse pucky, as you used to hear Colonel Potter say on MASH. We need to make certain we understand what services are paid by whom and delivered by whom. And then, of course, look at the carrier support that you have with the folks that you're representing. One of the reasons we speak very frequently about the dual special needs program with United is, one, they've done it forever. Two, they have the staff involved that can help you with these programs, and the agent support on a corporate basis is second to none. And believe it or not, we're finally at the point where we're going to go through that specifically. And Edie, to address your question, remember, for an agent to market United Healthcare dual special needs plans, you must be licensed, contracted, and certified for the basic modules in general, and DSNP in particular, to offer these programs. So your contract's got to be in good stead. You've got to have completed your certifications, and keep in mind the contract covers all areas of Medicare products offered by United Healthcare. It's a little different than some of the other carriers out there that may have one contract for MA and PDP versus their Med Sup. With United Healthcare, the contract that you have covers their MA plans. So these are programs that don't have the prescription benefit. There's still a few of those around. A lot of times folks market those to vets. Hey, we got a webinar coming up on that too. And the general MAPD programs where you have the Medicare Advantage prescription drugs integrated into the program, the SNP programs that we were discussing today, the standalone PDP programs, and the AARP Medicare Supplement plans. Keep in mind the base contract requires you to do some basic modules for certification that can be waived by your AHIP that you've probably already done. And then it'll ask you to go through certain components for specific products. There are some you need to complete, there are some that are optional. And we see many agents that'll go into the program and do the basic certification, do the certification for the general MA plans, and they don't do the SNP programs or the Med Sup piece. Don't know why. It's pretty simple on the Med Sup, particularly having full portfolio certification. We highly recommend that because it gives you the opportunity to be able to pivot in a sales presentation to maximize the benefits based on the qualifications a person has. And it's how you get the most carrier marketing support. And to be honest, if you're interested in the retail program that United has on their own outside of the legendary or infamous Walmart program, keep in mind you have to be portfolio certified to qualify for that marketing program. And I strongly recommend that you take advantage of the live market trainings and webinars that are available to you through any of the carriers you contract with, but specifically for United Healthcare. They know what they're doing, and a specific market training helps you tons with knowing what providers are available and how you can access the support of the local market management. It's also a great way to get to know your agent manager and get buy-in on their support because of your partnership with the offerings made available through United Healthcare. So some of the things that we see with United Healthcare on a more general basis with their DSNP programs, this is a program designed to coordinate care and maximize the plan benefits a person has. So we are seeing a design that offers clinical programs, benefits specifically for the population, much as what we've talked about as the requirement the government has for a SNP program, and they've been doing it for a long time. The customer service is very, very good. It's excellent, very, very good, it's a misnomer. I've actually been in the United Healthcare Service Center, and to see them handle the volume of calls they do with the expertise that they do, and more importantly, answer the questions of our membership and get them resources that they need, it's second to none. This is a program that is designed in conjunction with feedback from us as independent agents through our experience with this population and through the data that United Healthcare has available to make certain that the benefits offered year over year are those that interest the population the most. And this is the market leader in the country. They're number one or number two in most of the states that they serve, and they know how to do it. Because they also have the experience with Medicaid managed care, their programs are designed to work carefully with that coverage as well. So they work hand in hand to enhance the programs, even if they may not be the individual company managing the Medicaid benefit. Let's face it, we're seeing managed care come across the board all over the country for Medicare recipients. Same thing with Medicaid as well. It's an expensive proposition. The government looks to make certain that they can minimize their risk and contract out that coverage, and they do it well through programs offered by companies like United. Carrier is also very good at communications and resources. We're going to go through some things specifically about some of the resources they make available here in just a moment, and they have unique rewards programs for their dual SNP membership as well. One of the challenges I have with everybody diving into the DSNP market, and this is me personally, is sometimes agents will just, hey, I'll sell it. You do that without knowing what you're doing. It's a good way to put your finger in a mousetrap. You need to understand some of the basics with this and make certain that you're prepared for some of the challenges that come with the market as well. These folks it's a slower sale, a longer sale, I should say, or should be, so you fully explain the program. And it's a population that if you don't have all the decision makers made in the area and they understand what's going on, you can get some disenrollments that way. And these people can enroll and disenroll each quarter. So you have to look at the persistency and the retention. United is very adamant about the fact that their average DSNP member stays on the plan more than 4 years. Keep in mind, this is a population that in many circumstances have additional health challenges. We looked at that 2/3 of the population has 3 illnesses, chronic illnesses. Population within the DSNP community, there's even more in that community. So you'll see 5 chronic conditions in many circumstances with almost half of the population. And you'll see as you visit with people, they'll bring out shoeboxes full of medications. It's important that we do what we need to do in order to make it work. When you look at the population of this community across the country and how United Healthcare handles it, you see a strong representation of the offerings they have and an expansion for that in 2020. In Texas, we're unique. What are there, 256 counties in Texas? I always confuse that number. There's a DSNP program available in every county in the state of Texas. When you work with some of the other states, it's a little bit different. If you deal with what we used to refer to as the legacy states, these are programs that were available in 6 states through a purchase with Care Improvement Plus. You'll see that carry over in all 6 of those states as well. When you look at some of the additional help that United Healthcare has available, we've harped on the agent support and training that's there. Jarvis is an incredible tool for you to use online to get additional information. I'm going to pull some specifics, illustrations of that in just a second, but you'll see it's a great way for you to track your apps. You have all the sales tools available in there, including the different training, the electronic enrollment process for United specifically, provider lookup, the prescription drug list, making certain you know all the plans that are available in an area, and search through all sorts of components that are necessary for you to use in order to make certain your client understands the sale. It's all there for you. The Lean program is the enrollment tool, electronic enrollment tool for United Healthcare Medicare plans. It's across the board for each of those components that we talked about that are part of the contract. The MAPD programs, the PDP programs, and the Med-Sup programs. And then the toolkit, I got to tell you, there is no company in the industry that offers more marketing support for you than United Healthcare. And there are some really cool ways that we can get you deeply involved with this, and I'll show you that in just a second. When you go to Jarvis, uhcjarvis.com, this is where you, once you have logged into the system, it's where you can find additional training in the same area that you used to launch your certifications for the program. It gives you that training calendar month after month after month. These are live and webinar trainings in different areas with different support in different components of the products that they offer. So some really cool pieces that are available for you 24/7. So you don't have to come on a specific time and listen to a yahoo like me yak on about the different programs they have. It's all there for you. Boy, I hope that doesn't mean a bunch of you drop off and go there right away, but hey, it's there for you. And it's also where you can find the toolkit. It's a different pop-up site, and it gives you the opportunity to go in and look at different specific marketing materials so you stay compliant. When we speak of direct mail programs, I am a huge component, or proponent, I should say, maybe a component too, of generic mailers. You get a higher response generally. An exception to that are dual special needs programs. And United Healthcare has a ton of logoed programs for the dual community, and they may also have marketing support to help you pay for that mailing as well. That depends upon the market and the marketing program you lay out to them, the relationship you have with certain marketing folks in your particular market, and also some influence made by your upline, such as us. That's one of the reasons we harp on these products all the time. We do a lot of business with United Healthcare, and we can help you in that regard. When you look at some of the specifics for 2020 in Texas, you're looking at different markets across the board. And when you look at El Paso, you see that this is a market that United Healthcare has a very substantial share of it presently, but it's just over half penetrated by dual SNP programs. And when you consider that there are over 18,000 people in this market that have no DSNP program, it's still a very viable market. And hey, it's El Paso. That means you got to go to that toolkit program and have material in English and Spanish. It's there for you. And it's a strong program where you see some unique benefits for different demand programs within the DSNP world. So they have a very strong over-the-counter benefit with a debit card at Walgreens or mail order, $350 a quarter. You have $3,500 worth of dental credits for covered services, $2,500 for hearing aids, and 0 copays for virtual doctor's visits. That's the copays you see when you go to the doctor live too. But it is a very strong program in El Paso. The different benefits that are laid out here, for me to go through these in each and every market, and I'm already almost an hour into this, you're going to go, shut up, John, I can read. Yep, you can read. This is coming to you. If you are looking to market this specifically and you don't want to pull it out of the presentation, respond back to the follow-up, and I'll make certain that we get these for you specifically for El Paso and any market that we deal with. When you look at some overall benefits for the Texas market, these are looking at a specific DSNP service area that goes off of basically the Austin market into the Golden Triangle out into East Texas. This is not as penetrated as the El Paso market. Strong benefits across the board, a great opportunity for you. I can speak to you about some of the people that are feet on the street, so to speak, with United in these markets. Great people to deal with. Same sort of thing when you talk about these different benefits that are there. And these are benefits that you see in each of the markets that are of great interest to the population. Acupuncture, chiropractic, dental, fitness programs, foot care, hearing, meal programs, nurse line, the over-the-counter benefit, the personal help I've fallen but I can't get up. United can't say that. I shouldn't either, because that's not the company that supplies this, but that's the concept. The solutions for caregivers, which helps those people that are part of that decision-making process, the transportation benefit, virtual benefits, and the vision help. Here you're looking at basically Wilkerson, Travis, and Hayes. This is the Austin market specifically on a secondary plan. Wow, smaller penetration in the DSNP market. Great one to work. What you have in this market are things that you need to look at for providers. It's a thing you need to make certain that we coordinate that well for it. Good benefits across the board. You look here going down into Nueces, San Patricio, you're looking at the Corpus Christi market, a little more heavily penetrated, still a great opportunity, great place to market and live. But the benefits are strong. Here we're looking once again about a second program in El Paso. What you have in these are subsets for United Healthcare in general and a key provider program in other circumstances. Great benefits across the board once again. Here we're looking down at the Valley, Cameron, Hidalgo, and Willacy counties. Great opportunity. United doesn't own as much down in this neck of the woods. A great place for us to work. You got over 43,000 people down there that need your help with these great benefits. Come up here into the Dallas market, the DFW market. It's a penetration for DSNP that is not nearly as fulfilled as we see in some of the other markets. United Healthcare has a big share of that. She's got almost 100,000 people that need these programs that aren't in one in DFW. Great place to live and work, let me tell you. Great benefits as well. Here we're going down into San Antonio market. You'll see that United has a big share of the market. It still gives you a lot of opportunity with nearly 43,000 eligibles that aren't in the DSNP program from any carrier. Great benefits. And here we're looking at one of the El Paso market again with a secondary plan. Some great opportunity there with nearly 12,000 beneficiaries with great benefits. Once again into the Valley with a secondary program with a provider, great benefits. Here we're on to the United Healthcare benefits once again back in the Metroplex. Yeah, look at that. Nearly 100,000 people with great benefits waiting for you to chat with them. Secondary program with the folks in El Paso once again, and the Corpus Christi market. When you look at it overall, this is the mention that I had earlier in the presentation. Every county in the state of Texas has an opportunity for you. These are the old CIP programs. For those of you that have been in the business for a while, 500,000 people in the state of Texas that need help in this area with dang good benefits and a way for you to work wherever you happen to be. Oh, left Steve in there for a minute, and I'm tagging it myself. Some of the things why you want to do this with us: we can help you contract with multiple carriers easily. This gives you an opportunity through SurancePay to create an agent profile and contract with multiple carriers electronically. For United Healthcare specifically, you can contract by paper through this system, or we can send you an electronic link we generate directly from United Healthcare. That's the fastest way to get your contract done. We can get that done for you as well. We also have a way to keep you covered regardless of whom you contract through with all of the carriers that you have available. We realize as an independent agent, you can go a whole bunch of ways to get contracts with a whole bunch of different carriers. This covers you regardless of who your upline is. It's not like adding you to a blanket E&O just for one program. It's very affordable and budgetable and is done through our relationship with 360-degree Coverage Pros. We also help you keep your license in play with discounted continuing education through our association with WebCE. And as an independent agent, you also have an opportunity to enhance your own benefit package through a modified guarantee issue program for disability income for yourself. It's discounted rates, you share in the commission, and it's a great way to make certain that you cover one of your most important needs, and that's your ability to make a living. We also give you different electronic support tools at no cost to our contracted agents. This quoting tool is one we contract with through CSG to deliver. It's a great way for you to quote med sups, not only to do a complimentary Medicare Supplement review for your folks, the other end of the spectrum from DSNP, but also helps you collect and store the scope of appointment electronically. Remember, you need that scope of appointment covered before your presentation starts with any MA or PDP program. And regardless of whether or not you sell that individual, you're supposed to keep that for 10 years. This will allow you to do it electronically within the system. It also gives you the opportunity to cross-sell other programs that are part of the Medicare world, in many cases not really addressed through the base medical coverages that are made available to you. And there are certain markets where you might go into with, let's say, with a regular MA PD program where the carrier has a huge penetration in the market, wink, wink, nudge, nudge, United Healthcare. You aren't going to move them off that program, but it may be a way for you to use an electronic tool to help them understand they may need a hospital indemnity program to cover that daily copayment in the hospital, or add on a dental program, because regardless of the dental coverage you get with a base program, you can always use more. Our Medicare Center program is a way for you to do MA and PDP programs electronically, remotely as well. And it gives you the opportunity, once again, to store that scope of appointment form within the program and to do it compliantly and remotely. We do these trainings regularly. We record the vast majority of them. They're available on our website and on our YouTube channel. I have a listing of these as well and a link to where you can find them. It goes into not just products like what we're discussing today, but also marketing philosophies in order to get you in front of individuals. Great ways for you to become the subject matter expert in the markets you serve. Marketing through centers of influence in the community, through relationships with providers. Hey, you got a webinar coming up on that too. We also take the different programs that offer different incentives. MA programs don't do this because of the standardized commission that's dictated by the government, but it's a great way for those extra programs that you offer, or Medicare supplements. These carriers often offer trips and incentives. We've centered them all in a singular place, and many of them help you qualify for our own producers convention, which this year is a trip from Miami to the Bahamas. So if you're one of those sun worshipers, it's a trip to aspire to. 2021 trip is about to be announced. We also have different lead programs that help you get in front of individuals. If you look to cold call, obviously you can't do that for Medicare Advantage or PDP programs. There are programs that do allow that. We can help you with custom lists based on your market, income constraints, all sorts of lovely things. Be either deeply discounted cost or no cost to you, depending upon your contracting situation. Also have programs that help you with those community-based programs. How to make retail marketing effective, not just going to a Walmart or a Kroger or whatever, sitting there and waiting for someone to come up and slap down a TV dinner and say, hey, do you know what this costs? That's not why you're there. Working the community to enhance your position within that community and your selling opportunity within that retail opportunity as well. Approaching faith-based organizations to do regular presentations there. We have the different webinars, or pardon me, PowerPoints that are available to you to use for seminar selling. If you're not comfortable in front of a crowd, perhaps it's setting up a camp at a church or a temple or a mosque, or in a different center of influence within the community that give you an opportunity to market year-round. We also have programs that speak to marketing with providers. We got a webinar on that in 2 days. And we talk about not just contracted doctors with primary care doctors with MA programs, accessing the whole community to make it an effective part of your overall marketing plan. Different carriers do generate prospects from time to time. MA programs are really good at this during open enrollment, and they do have programs throughout the year. However, it's one of those circumstances where you got to have some credits in your account to make this work. You can't go there and say, hey, I'm newly contracted, give me some leads. They're going to look at you and say, we don't know anything about you. Prove it. We can help you prove it, but also create that relationship to move on it down the road. We do have internet leads available as well. The final expense department's been doing Facebook leads for quite some time. We're about to roll that out in the Medicare world as well. We're a little slower on it because we got to make certain that we do things compliantly, but these are great programs to help you in that area as well. Really hot area to generate leads. And we do help with direct mail support based on your production. We deeply discount the cost of a mailing. We have 5 preferred lead vendors that we use. We work through preferred lead vendors, and that's how you access this benefit, because we work with them to make certain that the mailings are compliant. All said and done, we want an opportunity to work with you. We're asking for your business. It's then a case of, does this program, does United Healthcare's Dual Special Needs program fit with your marketing philosophy? We've made that decision. Let's work on it. Make certain that you're contracted, certified, ready to sell, and we work on it. And as John Wayne says in the movie The Cowboys, which I've watched 3 times over the last week and a half, I really need a life. Hey, we're burning daylight. Let's get it going. You can reach any of us here at Premier through our toll-free number at 1-800-365-8208 or through our website at premiersmi.com. Watch for the follow-up we'll be sending up and out to you as soon as the recording updates. If you have specific individual questions that can be responded to there, just like, hey, John, send me the acronym translator. We need specific help in this area. Email me back as well. We'll make certain that we get you taken care of and we get you underway. All that said and done, I want to thank you for the commitment that you've made to today's webinar, the time that you spent with me. And until we speak again, I wish you good selling. Thanks so very much, and we'll talk to you very soon.